Okay, good afternoon. I'm Helen Rosenfeld. I'm the Executive Director of the Massachusetts Science and Engineering Fair. Really excited to have you here with us today. I am joined by an MSEF alum, which is really exciting, Bethlehem Solomon. And it's just wonderful when we have alumni come back and participate with us. Thank you so much. I want to share a little bit about her and then I'll hand the floor to her. She at present is a PhD student with the Department of Epidemiology and Biostatistics at Imperial College London, where she's also a teaching fellow in public health. And Bethlehem has come through universities in the Boston area as well, having done her BA at Brandeis and her MPH at BU. And at present, her PhD focuses on measuring housing quality through a public health lens at a small area level in London and estimating its associations with health, but she will be able to share far more about that with you. And so excited to welcome you here. Thanks so much for joining us, and you have the floor.
Thank you. Thank you for giving me this opportunity. Very, very glad to be here and speak today. As was mentioned, my name is Beth Solomon. To give you a bit more about my background, I grew up in the Boston area, was part of MSEF in 2009, 2010, did some projects very unrelated to public health and epidemiology. The projects were more on immunology, oncology, pediatric oncology, things of that nature. So very much wet lab experiences. If you guys have questions on that, happy to talk about that. But after that, after high school, went to my undergrad as a pre-med major, hoping to become a pediatrician, going to med school. And as I was taking courses for my bio major, started taking some electives that actually had a lot of crossover with public health, and that really, really triggered my interest. And so I slowly shifted over to public health. At that point, took some more public health courses, ended up changing my major, doing a bunch of public health internships, both domestically and abroad. And I guess the rest was history. And right after undergrad, went into the MPH program, as mentioned at BU, and did my MPH with concentrations in both epidemiology and global health. And then from there, actually took some time in the UK, was at the University of Cambridge, doing a fellowship there with a group that looked at chronic diseases or non-communicable diseases. So things like cancer, diabetes, hypertension, etc. And being able to conduct studies to understand the epidemiology of those diseases and their risk factors in sub-Saharan Africa and Southeast Asia. After I did that fellowship, I came back to the US and was doing some consulting for a pharmaceutical company. As an epidemiologist there, what we did is called disease forecasting. Basically, as you all know, pharmaceutical companies have a lot of decision making in terms of where they invest, where medications are made, for what populations, for what conditions, and a lot of that must be, well, not a lot of it, all of that must be based off of epidemiological evidence. And so that's the team that I was a part of. So we looked at diseases, their risk factors within different populations to understand what the trends were over time, over specific populations, and where there may be interest for the pharmaceutical company to explore, to invest in, etc. Again, happy to talk about this a bit more if you guys are interested. And then from there, went back to the UK, where I am now at Imperial College London, and originally started actually as a research assistant on a project called the NCD Risk collaboration, which does work that looks at trends of risk factors for non-communicable diseases that I mentioned earlier. And basically, it's this really, simply this really, really big data hub of NCD risk factor data from all over the world. And we understand, we use that data from, universities, from government organizations, from NGOs, from PhD studies, any type of data. So very, very data-driven work. to understand patterns, trends of these risk factors at the global scale, at a country scale, at a regional scale for different countries. So I did that for a bit and then started my PhD, as was mentioned, on something very different from the perspective of urbanization and looking at housing quality. How does where we live affect our health? So we know there's a lot of public health evidence that associates housing and housing quality with health, but a lot of that is at a very small individual home scale. And the purpose of my PhD is actually to develop a method that looks at housing quality and associations with health at a larger scale, so at a city scale. And the reason that that's of interest is policy and interventions must be done at the city scale for them to be as effective as possible. And so the idea is if we can measure that at the city scale and use that to inform policy and to develop policy, hopefully that will make a difference in our health. And so that's what I'm working on now. So, I mean, you can kind of see from my background the breadth that public health covers. And I think that that's the beauty of it. Really, for me, that's what drove me to public health ultimately. I'm not sure how much you guys know about public health. As a high school student myself, I didn't know that public health even existed. But to give you a very, very brief introduction to public health and really epidemiology more specifically, the focus is on trying to understand patterns and trends of disease over time and over space. So who's getting sick? When are they getting sick? How is that changing over time? Is it specific subpopulations? Is it specific geographies? Answering these questions and trying to get a better understanding of, you know, what's going on, you know, what's the prevalence of disease, what's the incidence of disease. And the ultimate aim is to treat that, but really to prevent, right? So if we can understand what's happening, where it's happening, to who it's happening, we can then implement measures to prevent that, very targeted interventions. And that's really the ultimate aim of public health. You know, we think about things like screenings that are very important in public health, but public health is also much, much broader than that, you know. So there's policy and public health law. There's a social behavioral aspect. So I'm just throwing these out there just to kind of broaden your understanding of what public health is. There were a bunch of environmental health projects that I actually was able to judge this year as well. So that also falls under that realm as well. So yeah, that's a bit about myself, a bit about public health. I think we can take some time maybe to answer some questions that you've prepared, Helen, and then maybe go to the students' questions after.
Yeah, so I'll start, and I just want to encourage everyone participating that you're welcome to put questions in the chat at any time or raise your hand and we can call on you. You're welcome to do it, you know, anonymously or through the chat, or you may also take yourself off screen at that point. But I'll start by asking, you know, when you think back to your schooling, are there any, and we touched upon this a little bit for those of you who are in the panel, the alumni panel this morning, but were there any sort of sparks or moments along the way which either reminded you that this is the path you wanted to be on or caused you to think differently and pivot a little bit and shift where you thought you were going?
Yeah, absolutely. So I can actually speak about, so I mentioned there was an elective course that I took during my undergrad. And so as I said, I had gone into undergrad wanting to go to medical school, and I was very, very focused on that. And I took this course, and the idea of, you know, health is more than just the biology really hit me. You know, there's so much more that's involved. So you know, I think I had a very narrow perspective coming out of high school. Again, you guys are much better than I am, or I was. So it was very much, you know, the biology matters, medicine, of course, matters, you know, medications and diagnosis and understanding the symptoms and all of that is important and it's extremely relevant. But there's so much more, right, that we can't just give a pill for. I mean, for lack of a better term. So issues like poverty, you know, and deprivation, education, you know, all of these things are so important for health. Nutrition, where we live, the geography, right? what city you live in matters, how much access you have to quality hospital and healthcare, to quality education. All of these factors are actually so incredibly relevant for health. And I didn't have that perspective coming out of high school. And so the elective course that I took really, really opened my eyes. And I was like, okay, well, there's much more. And this, if we really want to make an impact in terms of health, at least this is my thinking, that being a doctor is great. And if you guys want to go to medical school, we need doctors, we need nurses. So please, please do pursue that. There's a shortage of those. But there's also this other perspective that I think I was missing. And I was very, very much intrigued by that. And there was a lot of data and research that I was exposed to really for the first time. And that for me was definitely a spark, and being able to say, okay, there's this whole realm of health that I wasn't aware of. And even things, like public health law. I mean, the example that I always give is, people, we can't smoke in public areas, right? That's huge. I mean, we take that for granted, but that has such a big effect on, lung cancer, so many things that we aren't even always conscious of. And so being able to understand, health is more than just medicine. And it was really, really that course that really it gave me that exposure. So I would definitely say that was probably one of the biggest sparks.
Great. Can you talk a little bit more about this intersection of your work with policy and how, at what point, because I think students, they have this years of academic life ahead of them. At what point do you perhaps start to interact and work with folks beyond your discipline or your research, not so much your research area, but your disciplinary focus, to connect with these other disciplines or these other perspectives within the same topical area, if that makes sense?
Yeah, I mean, I don't know if there's a straightforward answer to that, because it really depends on the type of research you're doing, and kind of where along in the spectrum you are and where your project fits. But like for me personally, I can speak for the PhD that I'm doing right now. As I mentioned, it's looking at housing and health, which is actually quite a hot topic these days, irrespective of where you're living, because urbanization is such a big deal, and such a prevalent issue really all over the world. And so for me, it was actually at the very beginning that I started speaking to people who are involved very heavily with policy, because we wanted to understand what is relevant for them, what are the tools that they're using, what are the things that they're considering, and what are they not considering that we need to bring to their awareness, what are the gaps that exist. So sometimes, I mean, we think about, okay, let me do the research and then give it to policy makers or people who are involved in policy so that it can inform their policy. But I'm also a very big fan of, well, let's get them involved at the beginning so we can understand what their thinking is, what they're missing, right? So we can give them that exposure, and they can, even giving them a heads up and say, this is what you're missing out. These are the gaps that exist, and this is how my work will fill that gap. And staying in touch, keeping them updated throughout that process, and keeping that conversation going, so that by the time you do get your results, it'll be much more efficient, much more seamless process, and actually implementing your research into the policy.
Right. Great. Thank you. Can you also perhaps talk a little bit about making the local global? So in that, the research you're doing now is very localized to London, it sounds like, but it has global ramifications, presumably. And it sounds like from your background, you have this global perspective and interest. And students may not be familiar with the SDGs, the Sustainable Development Goals, and how does that fit in? So perhaps explain a little bit about the SDGs and if it feels relevant, or what it is, right? It's a framework for students. There are a number of different sustainable development goals that are sort of a global set of parameters by which we want to create change in the world. But to the extent that the local can be global and vice versa, perhaps you can share a little bit about where that's come into your work.
Yeah, sure. So it's a loaded question.
Yeah, sorry.
No, that's fine. That's fine. Yeah, so I can start from my project. So absolutely. I mean, I think every public health issue is relevant anywhere. That's my perspective, and housing is definitely one of those, as I've mentioned. So for my project in particular, I actually do start from that perspective. And when I develop, so the first part of my PhD is actually just defining, what is housing quality? Because it's a very complex, very involved concept and phenomenon. And so I actually ended up developing 13 domains that comprehensively, when they're looked at together, define housing quality. So things like mold and dampness, air quality, lighting, noise pollution, all of these factors that are relevant for the home. So there's 13 of those. And as I said, collectively they define housing quality, but how relevant they are is very dependent on where you live. The temperature, so air quality, for instance, is very dependent on where you live. Noise pollution is very dependent, even within, not even like country, even within Massachusetts, for instance, right? From city to city. If you live in downtown Boston, that's very, very different from living in Walpole, Mass, right? So all of these factors are relevant. And the spatial aspect, the geographic aspect is very, very relevant. And so the way that I approach the PhD is developing that framework that is applicable anywhere, and then taking London as a case study to show how it works. So does that make sense? So I chose one domain and I chose one city and said, okay, if we look at this specific type of geography and temperature and issue, this is how we would measure housing quality. And these are the tools that we would use. And the idea is then you can still use that tool, adapt it to the data, to your geography and the context that you have for the housing quality domain that you're interested in, and apply it somewhere else. So that's the hope of the PhD, to really be a tool that can be used anywhere. And bringing this into the perspective of SDGs, so as was said, it's this framework that was developed by the WHO and other partners, and there are 17 goals that quite lofty, right? So the first one is like end poverty, but the idea is that, we have these common public health related goals that are relevant, and that we should be working towards. And a lot of the work that we do in public health actually crosses over with multiple SDGs. And so that's nice. So, like water and sanitation is part of the SDGs. It's also one of my housing quality domains because it's relevant as well. So there's a lot of crossover in terms of that. I don't know how much detail you want me to go into that, but okay.
Yeah, no, I just think it's important for students to hear about the full perspective, the full spectrum, right, of how their interests also might feed into the work you're doing and where they can plug in. I think for those of you on the call, I know that often picking your subject, your topic for your science fair project is just so overwhelming because there's this extraordinary breadth of opportunity. But at the same time, you can make it very local to a place you live, an area of interest that has bigger ramifications, broader ramifications, but for the purpose of this project can be very accessible and doable. So that was sort of the context in which I asked that question. So we have a question in the chat that I just want to make sure we get to. Do you have any suggestion for high schoolers who are really interested in nutrition and public health? And I guess if the student who asked that is willing to share whether they mean by like periodicals that you might want to read or academic opportunities ahead, you're welcome to share more detail, or we can just go with the question as it is. I'll just pause a second if you want to. Yeah.
I'm wondering about like the courses that is like useful for this field. So do you have any suggestion for that?
Sure. So I'm assuming you're talking about in college, right?
Yeah, or like more opportunities for the future careers.
So actually, nutrition is a very, very big topic within public health. So there are actually, normally when you're interested in public health, there are nutrition specific courses. So even as mentioned earlier, like I'm a teaching fellow for the Masters in Public Health program at Imperial. So we have like a nutrition epidemiology course as part of the Masters. So a lot of times there will be nutrition specific courses, but something else that you can do probably even now as a high school student, and I'm not sure if you were at the earlier alumni panel, but I had mentioned that when I was in high school, I was involved in multiple summer internships. So there are many internships that are public health geared that you could also consider joining. One that I was a part of, not on the public health side, but I know does public health work, is the CURE program. So CURE. I think that stands for Continuing Umbrella for Research Experience or something like that. It's based at the Dana-Farber at Harvard Cancer Center. But they also, I know that there's a lot of public health work there, and they do work related to nutrition as well. So there are other programs, I'm sure, that you can try to get involved in that do that type of research or that type of work. Or a third opportunity is to really, I mean, and I've done this, I've gotten internships this way, believe it or not, is to reach out to professors that are doing this work and say, hey, you know, my name is Beth. This is what I'm interested in. I've looked at some of your work and I think it's fascinating. And I would, you know, is there an opportunity to collaborate or to volunteer in your lab, in your research? And many, many times, professors are happy to take on students. Like I said, I myself have gotten internships that way. Talking about the, believe it or not, again, the fellowship that I got at the University of Cambridge right after my master's program was started by an email conversation. So putting yourself out there, showing your interest, you know, read up, try to find if there's a particular like area, a niche that you're interested in within nutritional epi, because it's very vast. And if you find people who are doing research that's related to that area, reach out to them, send them an email and say, you know, like I said, I'm interested in this work. Is there any way that I can be involved? And I'm sure people will be happy to bring you on board.
Thanks.
Thank you.
Students, feel free to keep your questions coming in the chat and we can address them. I think I'll follow up with a question to that, which is, you know, thinking back, and it may be thinking back to high school, if you will, for a moment. Was there anything that you took as a course or experience you had that you think back that you didn't think was relevant to what you're doing now, but you now reflect on and think, oh, that course in whatever really was important. It didn't feel important at the time, but wow, it's been relevant and connected. I think students are often wondering, you know, what courses, with the limited number of courses available, which ones do I choose and what's really important? Any thoughts on that?
It's a very interesting question, and I'm probably going to give you a very unexpected answer. But probably I think one of the courses that I really think that about is my 10th grade English class. And the reason for that was, again, I know unrelated to science, but my English teacher, and probably I think the only English teacher that I think was this good at doing what she did, was she was so critical in her analysis of the literature that we read, to the point where I would honestly be like dumbfounded in class. But it gave me a very different perspective and, you know, gave me this insight that, okay, you know, I can think about what I read in a different way. And thinking about it in a more critical way and in a more engaging way. I mean, I honestly looked forward to that class. And I mean, 9th grade, the year before, did not look forward to my English class. So it was a brand new experience for me, but it was just, it was amazing the way that, you know, she really broke down the literature, you know, really had us engage with the literature and think about it in a different way. And for me, it really changed my perspective, honestly changed my perspective. And not just for English, but the way that I read text in general, to ask questions, you know, think about, you know, what is the author, what is the writer getting at? And really give myself the opportunity to wrestle with text, to wrestle with literature. I gained a lot of those skills in that class, and that's
Mm.
helped me, right? So, I mean, as scientists, we read, especially, I mean, public health as well. We do a lot of reading, a lot of engaging with literature. You know, you have to know what's out there, and being able to have that skill of, you know, like I said, engaging with the text, asking the correct questions, thinking critically about what you're reading, and really digesting it was yeah, that was one of the, I think, very, very important skills that I learned. So I know, unexpected answer, but
I was hoping for something unique. um, does anybody want to raise their hand and ask a question? You're all very quiet today. Please don't hesitate. Otherwise, you're going to have to continue with my questions. Okay, well, we're coming up on, in a couple minutes, we're going to have to wrap up. So I encourage you to put your questions in the chat or to give us a hand raise. So tell us maybe a little bit about what your day-to-day work looks like as a researcher.
yeah, sure. Lots of data currently. So a lot of, as I said, like I'm developing this method to measure housing quality. Obviously, that's very much constrained by the data that I have. Learning lots of statistics. So what I will say, a lot of so I've obviously taken stats courses kind of prior to my PhD. And then I started my PhD, and there was this whole other philosophy of stats that I didn't even know existed. So I had to learn that. And that's what I'm applying. It's called Bayesian stats to my work now. So a lot of like R coding. So R, for those of you who don't know what that is just a statistical software program. So those of you who want to learn coding but still want to go into public health, there's opportunities for that as well. Data analysis, data visualization, all of that is very, very important within public health. So I do a lot of that kind of on the day-to-day. I think there was just a question asked, so I'm going to pause so we can get to the student's question.
Sure. It asks if there are any opportunities for high school students in the current project you're working on or have worked on.
Oh, interesting. Maybe I should oh, that's a very good question.
You may get a lot of folks on this call applying for a summer internship.
Well, I'm based in London, so I don't know if your parents will be willing to send you off to London right now. I mean, we do try to get students, at least I know, at least that are in undergrad within Imperial that join. I don't know about high school students, but that's definitely something I can think about, because there's definitely kind of smaller pieces that students have been involved in kind of different capacities. But I think that is saying that my project is interesting. So thank you.
Yes, I would definitely agree with that. Well, and I think, you know, just on a personal note to students who are interested, I think what you said before was very relevant. You know, people in professors and folks in the research world and universities are often very eager. They're so pleased that you're interested in their work that if you express interest, there's often a piece or you know, it might be a small piece of a bigger project or some component that you could get to know and be part of as a student. And so don't hesitate to reach out and make those inquiries. I mean, the worst is that somebody can say no, and there's no problem in that. That's a good experience as well, to learn how to reach out and pursue those opportunities.
Yeah, I've gotten multiple internships like that. Honestly, reach out. It's just an email, and you can send the same email and just change, you know, a couple of words to different people. Because you don't need to say. I mean, of course, read on their research, you know, find out what they're doing and make your tailor your email specific to the person that you're writing to. But people are interested, people are willing. I mean, I've probably sent hundreds of emails like that, but have gotten some of the best opportunities. I've gotten opportunities here, like Tufts School of Public Health. I mentioned earlier in the UK, in Ethiopia. I mean, I've gotten kind of opportunities in different places, and it's really all about putting yourself out there. So if there's a project that you're interested in, I mean, let's say you're interested in, I don't know, I mean, let's just stick to what I know. You know, diabetes in Southeast Asia, I'm sure, especially in Massachusetts or in like the Boston area, there will be people working on this stuff. Boston, Massachusetts, it's such a rich area for public health. So reach out to these people. I mean, especially now, I mean, in this age of remote working and remote learning, people are happy to even bring you on remotely as well. So reach out to them. As Helen said, the worst that they can say is no, and you say thank you and you move on. But I'm sure you will not be disappointed.
Well, I think that's a great note to end on. Our time is at a close. I think the message there is be persistent and don't hesitate, because there's a world of opportunity out there. Beth, I want to thank you so much for joining us today. It's been such a pleasure to have this discussion with you. And thank you to all of the students and visitors who are with us on the call.
Thank you for having me.
You're welcome. And I hope you'll all join the sessions for the rest of the day. Thanks so much.
Thank you.